There's a new tool that can help the nearly 30 million Americans with diabetes get the most from their health insurance. Lisa Minute has the story.
With the healthcare landscape becoming increasingly complex, understanding your coverage and what you pay for services, prescriptions, and supplies is important, particularly when managing a chronic condition like diabetes.
It's important for people with diabetes to regularly test their blood sugar and, working with their healthcare professionals, use results to help make decisions about food, activity, and medication to stay healthy.
Unfortunately, Miller says many people don't check their blood sugar as often as they should, and one common barrier is the cost of testing supplies.
So there are a few things I recommend to help make the most of your healthcare coverage. One is a new free service from LifeScan, the makers of one-touch blood glucose monitoring systems called Know My Copay. It's a website and toll-free phone service that shows patients and their healthcare providers the lowest copay across major brands of diabetes test strips based on each person's individual health plan.
So how does this program work?
Know My Copay provides two levels of information based on the data provided by the user. In the first level, people can find out which products are preferred by their health plan by simply providing the type of coverage and the plan name. In the second level, by providing more specific information, patients and their healthcare professionals can review the actual copay amounts of the top 5 brands of test strips offered. Know My Copay is a valuable free service that can assist people in maximizing their healthcare coverage by comparing the out-of-pocket cost of the various diabetes test strips available in order to make educated decisions about the products they use.
To access this free service, visit knowmycopay.com or call toll-free 844-807-8936 Monday through Friday from 8 a.m. to 8 p.m. Eastern. Other helpful advice for diabetes patients?
For all prescriptions and supplies, ask your doctor or pharmacist if there's a generic or lower cost brand name alternative. You can often save between 20 and 90% by switching.
What else he says? Buy in bulk.
Many pharmacies give discounts if you buy a 3-month supply at once instead of a usual 30-day supply. Many pills can also be split. If your doctor tells you that yours can be, ask for a prescription that doubles the dosage of your pills so that you can split them and get 2 months worth of medicine for the price of one. I also recommend shopping around. Most people don't realize that drug prices can vary widely from drugstore to drugstore. Also ask if your pharmacy offers a discount drug program that may be a less expensive alternative to your insurance plan's drug cost.
Finally, Miller says the best way to save on diabetes healthcare costs is to improve your overall health with these 4 basic steps. Lose weight, eat a healthy diet, exercise regularly, and if you smoke, stop. In New York, I'm Lisa Minute.